1. Take Coenzyme Q10 supplements. Coenzyme Q10 is a natural supplement and antioxidant that, when used regularly, can reduce systolic pressure by 17 mmHg and diastolic pressure by 10 mmHg. This supplement makes it easier for the heart to pump blood by dilating the blood vessels. Ask your doctor about this supplement. Your doctor may recommend that you take 60 to 100 mg of Coenzyme Q10 up to 3 times a day. 2. Investigate diuretics. Diuretics remove excess sodium and water from the body. Since sodium is the main culprit of high blood pressure, removing excess sodium from the body can significantly reduce blood pressure. 3. Think about beta blockers. Beta blockers cause a decrease in heart rate. As a result, the heart pumps less blood and thus blood pressure goes down. 4. Try ACE inhibitors. ACE stands for Angiotensin Converting Enzyme. This enzyme causes the body to produce angiotensin, a chemical responsible for the contraction of the arteries throughout the body. ACE inhibitor facilitates the passage of blood by opening the blood vessels and reduces blood pressure. Learn about angiotensin II receptor blockers. This drug directly inhibits the action of angiotensin, which is responsible for the contraction of the arteries. For angiotensin to affect blood vessels, it must combine with a receptor. These drugs block the receptors and thus prevent chemicals from taking an effect. 5. Look for calcium channel blockers. Calcium channel blockers act by preventing calcium from entering the heart and arteries. Calcium enables the smooth muscle cells in these areas to harden. This means that the heart has to use more power to pump blood to the arteries. This drug lowers blood pressure by relaxing narrow blood vessels. 6. Learn alpha blockers. Alpha blockers reduce the resistance in the arteries. As a result, vascular muscles relax and blood flow is facilitated. Investigate alpha-2 receptor agonists. This drug reduces the function of the sympathetic part of the autonomic nervous system. Thus, less adrenaline is produced. Adrenaline, along with other stress hormones, can cause blood vessels to contract. Take a combination of alpha-beta blockers. These are the first line of defense for patients with critically high blood pressure and lower blood pressure faster than most other drugs. This drug reduces the resistance of the arteries and causes the heart rate to drop. 7. Learn about central agonists. These drugs prevent the blood vessels from contracting easily, thus allowing the blood to flow through the vessels more easily. Note that this effect is similar to that of alpha-beta blockers. 8. Learn about peripheral adrenergic inhibitors. The main target of drugs in this group is the brain. When you take these medications, the neurotransmitters responsible for delivering messages to the smooth muscles of the heart and blood vessels are blocked, so that the message that tells these blood vessels to contract never reaches its place. 9. Buy a vasodilator. These drugs only relax the blood vessels. As a result, the vessels dilate and allow blood to flow with less pressure.